Hi, I'm Neil Nobel, editor-at-large of the Prickly Pear, and welcome to the Cactus Patch. Our guest today is Naomi Lopez, Director of Healthcare Policy for the Goldwater Institute. Naomi, thank you for joining us today.
Thank you. It's my pleasure.
Well, it's been a turbulent year, I suppose, for anyone in the professional healthcare arena. We haven't had a pandemic like this since about 1919, I guess. I've seen some writers compare it to 1958, 1968, the polio breakout of the 50s. What made this particularly different from previous pandemics?
Well, I think that there have been some pretty serious pandemics, but they just never reached U.S. soil or reached U.S. soil in a significant way. And I think one of the biggest concerns was just that there was so little known about this highly contagious virus at the early on, and so I think that that definitely made it different. And then think about global travel and the way that the virus spread so quickly. We're a very mobile society and we have a lot of transportation options. And so that I think really accelerated the spread of this particular virus.
In the early stages of this, I tend to give authorities kind of a pass. I don't think they really knew entirely what they were dealing with back in January and maybe December of 2019 into January of 2020, maybe February. But then they decided on a policy which I don't think had been used before. What some people call it lockdown. And we saw a lockdown in various degrees among states in the United States. Among nation states, there were some easy lockdown states like Taiwan, Sweden, severe lockdown states like Britain. Now that we've had about a year to digest the data, from a 30,000-foot view as a health professional, how do you rate our response?
Well, I think that, in terms of rating the response, I think that we did exceptionally well in getting a vaccine to basically getting people dosed in less than a year from the first confirmed case here in the US. That was extraordinary. Before this, it's the fastest vaccine came out. It took about 4 years. And so what was accomplished here was absolutely extraordinary. But we always have to remind ourselves that we absolutely can do better. Most people don't realize that the actual vaccine that Moderna created was actually created based on a COVID sample, and they created that within a weekend before the first confirmed case in the US. Let that sink in. They had a vaccine before the first confirmed case here in the US. And I'm not saying that it should have been given out at that point, right? I mean, we have to test it and we have to make sure that it's safe. But imagine what it would have meant to the pandemic had we been able to distribute that, say, in 3 months or in 6 months. We would have a very different situation. So in other ways that I look back, obviously the information was not well established early on. We did not know what we were dealing with. But as more information became available, I think what you saw was the conflicting priorities of public health versus the economy. Mm-hmm. There was no single goal. And when you have these two conflicting goals, sometimes they're mutually exclusive. And I do think that there were certainly cases where, I think the frustration on the public was really elevated because they saw the misapplication of these rules. For example, Governor Whitmer in Michigan was notorious for basically locking down nurseries that sold seeds so that people could plant gardens, but leaving Home Depot open. I mean, there really is a big misapplication in terms of, who gets to define what's essential. And I also do think that, unfortunately, I think, a lot of the public probably for a variety of reasons didn't take it seriously enough. And so we do have, I think, there will be a lot of lessons learned in the future when we look back on this pandemic. But I'd say that we are incredibly fortunate when we take a look at the impact that COVID has had. And while absolutely devastating and tragic, it really could have been worse had it been MERS or SARS or Ebola breaking out here in the US.
Speaking of government response, probably no one else has put a face on this as well as Dr. Fauci. And in a recent congressional testimony, he was pressed upon exactly what are the thresholds which have to be met by society before we can get our freedom back was one of the questions. And it struck me that he didn't seem particularly concerned about liberty. He didn't seem particularly concerned about the economy. He was really working within his intellectual silo of being a healthcare professional. And I have kind of two questions about that. One is that the correct balance for public policy? And the second one is, even within his own silo, he seemed to miss the point that lockdown policies, by frightening people away from, say, getting their angiograms or getting other testing, some studies indicate that maybe 3 people will die for every one saved to COVID because they are going to be dying of non-COVID reasons. So if you could address those two issues, I'd appreciate it.
Yeah, so there's very clear and strong documentation that people didn't go to the emergency room when they were having heart attacks and strokes. I mean, that's documented. We also know that there have been extraordinarily large impacts for mental health. And we also know that the educational losses are going to be significant when we take a look back. So there really are a lot of impacts of lockdowns and the like. Now, when we take a look at Dr. Fauci, for example, like I mentioned before, their dual goals of opening the economy and protecting public health. He is solidly in the protecting public health. And if you don't want anyone to get sick, and if you don't want anyone to have to be hospitalized, well, your worldview is going to be that no one should take any risks whatsoever. So that's a very different worldview, I think, than most people. And in fact, I think that there is absolutely an important role to remember that individuals do take risks, and we do need to be very sensitive to the fact that individuals who take risks are imposing perhaps potential risks on others. And so, we need to make that distinction and be very clear about that. But individuals do have some, can tolerate risk and can make decisions. For example, if you're a 70-year-old individual who hasn't seen their family in months, you might decide rationally that you're going to take some, rational safety precautions and have Thanksgiving together, for example. I mean, so, these are very personal decisions. And, like I said, we need to, people need to be sensitive to the fact that they might be putting other people in danger or in harm's way in some way. But that, we have different tolerances and different preferences. And the importance of not getting sick may not be one individual's primary overriding, concern at a certain point in time.
Yeah, the balance of that decision making was largely taken out of the individual's hands, I think, and we might argue that the role of government here might be more for information, but even on that front, I'm just flying by my memory, but I remember a year ago there was talk that things would get better in the summer because it would be warmer. We were told that we had to distance by 6 feet. Now they've adjusted to 3 feet. There were innumerable contradictions in information, in fact, coming from the government. And you saw this even within states, significant differences in the degree to which they locked down, and heavy lockdown states actually had worse results than light lockdown states. So I even look at that and say, did government bungle even its information role here?
Well, so the information role is going to continue to change. I mean, what we know today is actually not going to be, I think, what is actually true when we look back in the future. For example, this distancing issue, what we're now seeing is that ventilation systems indoors are going to be far more important, most likely, than the actual distance and the amount of time that you spend in those closed quarters. And so the information is evolving, but we also have a virus that's evolving. We've got these escape variants. Some of them are pretty concerning. And the UK variant, for example, we know is very prevalent here in the US. And, we are probably going to look back and see that it's having an outsized impact in terms of hospitalizations than the original strains that we had here in the US. But in addition, there's some very concerning ones that are, there's a very concerning one in Southeast Asia, for example, that as far as I know, I don't think researchers have established that it's actually reached the US. but the story, but the story isn't completely written yet. We are still getting additional information. We don't, and what might be true for the original variants that are in the US may not be true for the escape variants that we'll probably be seeing in the next few months. So this information is very fluid, and it is going to continue to change. And so there is no, we're not at the end of this yet, unfortunately.
Uh, Still controversies about the vaccines, the RNA component of it, which I guess is revolutionary. There was a study I saw yesterday that raised the possibility that this would make us more vulnerable to neurological diseases like ALS, and Alzheimer's, and so forth. Are you convinced that we've had enough time and this has been distributed through enough people that these vaccines are safe?
Well, so I'm not a physician. I'm not. I don't have a medical background, but I will say that that I've been dosed with the Pfizer vaccine. I'm very comfortable with it, and I'm very appreciative to the researchers and scientists who put in the effort, the extraordinary effort to collaborate internationally in order to get a vaccine dosed to the public in such short order. Now, are there potential risks that we don't know about? Absolutely. There is surveillance that will continue to take place on these vaccines. These vaccines are not fully FDA approved. They are being provided under emergency use authorization. And so there is a requirement that continued surveillance does take place, but even for fully FDA approved treatments, there is additional surveillance. So we never know about something being completely safe until we find out that maybe it isn't. And so there really is no perfect information here. We will not have perfect information about whether or not these vaccines are completely safe. I will say that I am more than confident enough that I've taken the Pfizer vaccine. So I think we only know what we know right now. But I do think the promise of this technology that was used is going to be extraordinary. This was a giant leap forward in terms of the ability to treat diseases like ALS and Alzheimer's, where the technology that was used is being applied to new treatments and really could change the way that disease is treated and addressed down the road. It's actually a very exciting time. And the story of this vaccine is, I think, going to be important in medical developments for our lifetimes.
There was a report, I guess it was about a week ago, the chairman of Pfizer suggested that people get 3 shots. Now, again, this is the ignorance of a layman, but I'm not an anti-vaxxer. I want to make our listeners aware of that. I mean, I've taken the flu vaccines, I've taken the shingles, I've taken the pneumonia. I'm still personally waiting for some data to come in. I was leaning more towards the J&J because it did not seem to be the RNA type.
Mm-hmm.
And then this blood clot thing came popping out, and I guess now we're going to go back towards using the J&J. For the layperson, and we want people to have freedom to make decisions about their own healthcare choices. What are the criterion that they have to have in their head to make a decision about vaccines?
Well, once again, I'm not a medical professional, so they should have that conversation with their provider, with their healthcare provider, with their physician or nurse practitioner or pharmacist. But I will say that I think whenever we think about vaccines for COVID or even for the flu, for example, this provides temporary protection. It is not 100% protection. What we're seeing in the COVID vaccines is that the protection that the vaccines provide are to keep you from transmitting COVID or getting sick from it, or even if you do get sick with it, not to have to go to the hospital. They're extraordinarily effective for keeping you out of the hospital. It looks like they're going to provide temporary protection. We don't know how long yet. Is it 9 months? Is it 12 months? Is it a little bit longer? We just don't know. And when there is a variance in the length of protection, what makes that different? So I think people can think about it more like the flu vaccine, where you have to go back and continue to get immunized against it. And it, like I said, there's the expectation that it's foolproof that's not, no one should expect that. It is extraordinarily effective, but there's still a possibility that you can get COVID. But but the vaccine does provide enormous protection against actually having to be hospitalized and having the more serious side effects from the virus.
We ran an article, or we're about to, I've forgotten, I think it was Michael Fomento's piece about the correlation between obesity and fatalities in COVID. And it was like 80%, I think, of fatalities, people were obese. Um, from a public health perspective, there's been very little written about that, other than warning people about, if you're over 65 or 70, but I suppose you could be 45 and obese and be just as vulnerable or more vulnerable than I am without comorbidities over the age of 70. What should be done more on that front to protect the public?
Well, there certainly is a lot of research taking place right now. Even if so, it takes the research process for these studies does take quite a long time. But there are indications that comorbidities can significantly impact your outcome from getting COVID. But that's true for other illnesses like the flu, pneumonia as well. I mean, so it's not like it's unique to COVID. But I do think that we will be learning a whole lot more in the coming months and years about risk. It really is, looking back to look at these trends. I think that, people have been writing about the trends. The question is, is there a causational link between the two? If so, how much of a risk is it? What should be done? Even if a person, for example, there are a lot of questions, like maybe a person who used to be obese and is now at a healthy weight and isn't presenting other medical issues, what's their risk? So there's just a lot that we don't know that is yet to be discovered. But obviously, we have a nation where we do have enormous amount of obesity. It's almost an epidemic. We've got other issues like heart disease, like diabetes. I mean, we really do have some very serious public health issues that are probably imposing additional risks on other, from other illnesses.
Yeah, it seems that the Wuhan virus, or COVID, however you wish to term it, has sucked most of the oxygen out of the room in terms of many of these other health issues, which should be addressed. Which brings me to one of my final questions, and that is, there seems to be an attempt today to utilize the emergency powers which have been exercised because of this healthcare crisis to define other things as a healthcare crisis. For instance, crimes that are committed with the use of firearms, racism, environmentalism, or global warming. This is all a public health crisis. We're seeing a redefinition of what is a public health crisis. And I'm concerned about that, because you can bring an awful lot of things under the umbrella of a health crisis and then try to use emergency powers to override our constitutional protections.
So that was taking place before COVID. This has been ongoing for decades, where any public health issue is, there are folks that are interested in making it an emergency. And we even actually saw this under President Trump, where under the no eviction federal policy that was issued, which was quite disturbing, that a landlord no longer has property rights over their property because of this public health emergency. And so that was quite disturbing to see. And so I do share your concern that there is always going to be that pressure to expand what is in fact an emergency, a crisis. And of course, some of this is very well intentioned, but of course some of it isn't. And it's a money grab, it's a power grab, it's there's an interest in regulating more. And so I do think that we have to be very concerned about that. And there, under public health emergencies, there are extraordinary powers that are granted to the federal government as well as to governors around the country. And I think that, we now realize what that looks like and what that means. And so I do think that you will have some legislatures going in to really redefine what would and should be allowable under those emergency powers. You know, there are some cases where you can go into court and and get that rolled back, but in some cases, those powers are completely within the authority of those governors, because of their emergency acts and executive order authority. So,
Uh, how do you view Arizona's particular response? My own sense was we certainly were not Michigan, but we weren't Florida either. How do you think Ducey handled this?
well, I think actually quite well. So very early on, Governor Ducey took a lot of steps that I think really made sense. For example, particularly in the area of telemedicine, where we were trying to reduce in-person contact, but still meet medical needs, he really did open up the opportunity to allow for telemedicine to take place so that people could continue to get their healthcare needs met in a safe manner without it, further exposing medical professionals or individuals to the risk of getting COVID. At the beginning of the vaccination effort, there was a lot of criticism about a slow rollout in Arizona, but I do think that, I don't know the underlying reasons why that might have been the case, but Arizona is doing an extraordinary effort in vaccinating its citizens. That has been, I think, a real positive demonstration of the organization and the just the really strong competence of his executive team. So I do think that Arizona is doing quite well in terms of what's the right approach. I mean, it's always hindsight. We just don't know yet ultimately what is going to be the best approach. But I do think it was far more far more directed at meeting public health needs and reopening the economy. I mean, so I do think that that was much closer to, I think, where we really would prefer the governors around the country to really focus. We there with so much unknown about COVID even today, and I think it's really important to not to be too quick to say, oh, well, this state did, what was far more lax. We don't yet know if this is the end of the story. If there's a variant, if there's a variant that turns out to be quite devastating that hits one of these states, it's a little bit too soon to conclude what was the right policy. But I do think the governors that are aiming towards the dual goals of balancing public health and reopening the economy really are, I think, much closer to the bullseye there, because you've got to make sure that your healthcare system doesn't become overwhelmed and that people don't die for really, very, very, reasons that could have otherwise been handled except for being overwhelmed by COVID. And you also don't want to unnecessarily destroy people's livelihoods. I mean, that's really, I think the more that governors can do to make sure that both goals are being balanced, I think is really a good approach. And like I said, we're not done yet. We don't know yet what it's going to look like in the end. I mean, for example, Michigan has an alarming number of cases right now of COVID, and you're seeing new lockdowns in a couple of areas around the country. We've still got a ways to go.
Yeah, it's this has been a disruption in a lot of our lives, and it's changed our politics. I look at, again, from a 30,000-foot view, the amount of money that this government has gone into debt over, and the way that we have habituated the the public to receive checks from the government, and businesses and airlines and various sectors of the industry have basically become almost clients of the government. Wow. I mean, the centralization and the use of, shall we call it, central planning, which we couldn't see justified under other circumstances, has been really fully exercised here. And the implications will echo for decades, in my opinion,
Yeah,
financially.
you're absolutely right, and I'm glad you raised this because this is something that most people don't really connect the dots on. It's not easy to connect the dots on something, kind of this deep in the weeds. But yes, think about these individuals who right now aren't going back to work because these checks are, so substantial. And what that means, so I work on healthcare policy, is that they maintain their eligibility on Medicaid, for example. You cannot remove people from Medicaid during a pandemic. The states are going to have a really big problem once this public emergency ends in terms of getting people removed from the Medicaid rolls. And that is going to come at enormous cost to the states. And it's very, there are always implications and trade-offs for policies. And these are going to be significant in terms of labor force participation, in terms of lifetime earnings going down, being reduced, in terms of dependence on public programs. I mean, really, we are, I think, just now beginning to understand at least the very early effects of what this means. But yes, the impact of this will go on, I think, for generations. I agree completely.
And my background is more in economics than it is in healthcare. And I just look at the adoption of modern monetary theory,
Yeah.
that we would pay for most of this by simply printing money. And it's neither modern nor is it much of a theory. I mean, lots of governments previously have tried to pay for red circuses and foreign wars and what have you by printing money, and the results have been universally horrible. And the imbalance here, and that is where we are trying to strike a balance, I think, between the needs of public health, personal liberty, and the economy. And in that regard, my own opinion is, and I'll be charitable here because they maybe didn't know, but I think it's been lopsided, and we're going to have implications down the road well past this pandemic that could plague this country financially because of this.
Yeah, my background is in economics also, and I'm in complete agreement. And when you take a look at what the goals are in terms of monetary policy, it's a labor policy. It's not monetary policy. So yeah, we're in complete agreement, and the implications for what that means for public programs. It's just, I don't think we're going to be able to put that genie back in the bottle anytime soon.
No, it's going to be tough. Well, Naomi, we've taken a lot of your time today. I really appreciate you taking the time to speak with us. And thanks again for appearing on Prickly Pear.
Thank you for the opportunity. I really enjoyed it.